And in other health news, it's time for our weekly partnership with Asante. This week's Asante's health expert Beth talks with Dr. Jenna Diggs about what gestational diabetes is and if it's preventable.
Nearly 10% of the pregnancies in the United States are affected by gestational diabetes. Dr. Diggs, what is gestational diabetes and what are some of the symptoms?
Pregnancy itself actually creates a state where a mother's body produces more sugar or more glucose in order to actually provide nutrients for the baby to grow and thrive. But gestational diabetes develops when there's an imbalance in that the woman's pancreas is not able to keep up with how much sugar the woman's producing. And so that imbalance results in too much sugar in a woman's blood, which then can cross the placenta and go to the baby, who can also have too much sugar in the blood.
So what are the risk factors for gestational diabetes, and are there complications associated with it during pregnancy?
Absolutely. So the big risk factors are having a history of diabetes in a previous pregnancy, or a woman having a family history, say in a mother or father, of type 2 diabetes. Obesity is a big risk factor with a BMI, a body mass index, more than 30. And then people who are greater than the age of 35 also have a higher risk factor for developing gestational diabetes. And as far as the complications go, because it's so prevalent in our society, we have to think a lot about the problems in pregnancy, which include higher risk of having a cesarean delivery at time of birth, as well as larger babies who are born, and those babies having a hard time transitioning after birth, or even fitting through the pelvis at time of birth, which can increase the rate of birth trauma.
Are there things women can do before or during pregnancy to avoid or prevent gestational diabetes?
Absolutely. So we definitely like to encourage women before they ever get pregnant to work on their diet and exercise. Important diet choices are usually very well balanced, lots of lean meats, lots of vegetables, lots of whole grains, and maybe only about 30 to 40% of the diet is carbohydrates. And then during pregnancy, that also continues those same recommendations for eating, and exercise is really important. Ideally, the 150 minutes per week recommendation applies. If that's hard to accomplish in pregnancy, then we recommend at least after every single meal, a 10 to 15 minute walk to help reduce the sugar levels. And that applies to both women who have gestational diabetes, but also for women who do not have it. It's very important to continue a healthy diet and exercise.
This is just great information for healthy pregnancy and healthy baby. Thank you so much.